What are we learning that we maybe should have known and didn't know, but that we sure as heck better know now, because this isn't the last time this is going to happen. My name is Martha Page. I'm the executive director of a Hartford-based nonprofit called Hartford Food System. We've been in existence since 1978, and I've been in this position for almost 11 years now. We do a variety of both programming and policy and advocacy work. Our programming work encompasses a broad range of things like a farmer's market and a mobile market and youth programming. And we also do advocacy work in food policy and advocating for things like a new grocery store in the city. And that most of that type of work is very focused on the city of Hartford and populations here. We also, as an organization, are deeply involved in some statewide food planning work and some regional food system planning that is aimed at making it more possible for New England to feed New England. We, by name and by mission, are interested and want to be connected with anything that is in the food system. We have gotten involved in bus routes to make sure that people can get to the grocery store. We've been involved in food waste issues. We have been involved in like early childhood education and childhood obesity and in grocery store work and all of those things that are part of a food system. Food is a concept. We gather around food. You know, food is a connector. Food is a network builder. How do you get the benefit of food when the community aspect of that is compromised? From a programming perspective, there are certain things, programs that we do where the community counts on them as one of the elements of food access. And I'll give an example, our mobile market, where we simply had to quit running it because the places that we were going, this is a mobile food produce van that would go and set up tables, like, you know, sales tables in senior congregate living or in a health center. And we had a lot of stops that we did every week. Well, most of those places became off limits for people outside. You know, a federally qualified healthcare center didn't really want random people in the building. Places that are primarily senior serving became, of course, very, very conscientious, appropriately so, in reducing exposure of their vulnerable populations. So we had to just kind of like rethink the entire thing, had to stop the program for a while and are now trying to figure out how do we ramp it up in an environment where it is likely for the foreseeable future that we're going to not be able to do business in the same way. Similarly, our farmers market, which we did run this year, as did a lot of farmers markets across the state, but we needed to do it with a set of protocols, 6 foot distancing, everybody wearing masks, don't touch the produce, you know, things that people were used to being able to go to farmers market and come right up to a farmer and talk about the fruits and vegetables and handle them. And all of that, of course, we had to change. We did it, and we did it successfully, and it was a good year, all things considered, but just having to rethink how stuff is done. These methods allow us to broaden reach even in non-pandemic times, because not everybody's going to be able to be in person in your programming. Are there some ways and some things that we're learning that will allow us to increase the likelihood of being able to reach the populations that we want to reach because we have more methods of doing so? I think that we want this to be over so badly, but we absolutely don't want to be in the same position again. How do we approach this differently? How do we become more resilient? We need to remember what it is we're missing now, where the gaps were and cracks in the system were that we knew kind of existed, but we didn't know how deep they were. We need to be documenting what we're seeing. We need to remember how it felt. What are we learning that we maybe should have known and didn't know, but that we sure as heck better know now, because this isn't the last time this is going to happen. So it's kind of like, what can we learn so that we can build a more resilient system? We are connected with United Way on a project we call the Healthy Hartford Hub, to try to attract another full service grocery store that we desperately need in the city. We're not a large organization, so everything we do needs to be done in partnership. And so having a partnership with an organization like United Way on bringing folks to the table to get a major project like a new grocery store into the city is kind of like something that otherwise we can't get this work done, because we can't do it by ourselves. We're just too small. So we have to be in partnership. And quite frankly, I think that's a much funner way to do work anyway. Still a lot, still so much to do. And I don't think we're by any means, I think this is going to be a tough winter. But you got a lot of people on the case, and you got a lot of people thinking about it and thinking about it with new eyes. So this is, I think that's good. The more people who know this is a problem, the more the better. Let's all think about it, and let's all figure out how not to have this happen again.